This is for patients who have been evaluated and are going to undergo the endoscopic sleeve gastroplasty. Historically, there are many patients who are overweight who didn't do well on medical diets and exercise alone. A lot of these patients could not be offered surgical procedures in the past because the surgery carries some risk and the patient's weight needs to justify the risk of the operation. Now, with endoscopy, we should be able to offer this procedure to patients at a lower weight. You're going to arrive a few hours before the procedure, and you're going to be evaluated by anesthesia, have an IV started, and those kind of things, sign some forms, some consent forms, etc. The procedure itself is done under a general anesthetic in the operating room or an endoscopy suite. You'll be completely asleep for that part of the procedure. The duration of the procedure varies. It can be anywhere from an hour to 2 hours in general. After, you will go to the recovery room. I will go out and speak to your family and tell them how things went. The nurses are going to get you up and help you walk and also provide you something to drink. Usually within 3 to 4 hours, if you are up walking around, wide awake, and have had something to drink, then you can go home. You cannot drive yourself home after the procedure. Someone needs to do that for you. The first 48 hours after the procedure, it's important that you get up and walk several times a day. This is to increase the blood flow in the legs and to prevent blood clots after the procedure is over. We prefer the patient to stay on a low-sugar, clear liquid diet for the first 7 days. A low-sugar, clear liquid diet includes broth, water, iced tea, sugar-free popsicle, even sugar-free Jell-O. Nothing with soft or solid material in it is allowed. Usually I'll see you back in my office somewhere between 4 and 7 days after the procedure to make sure everything is going according to plan. If you do have some pain after the procedure, we prescribe liquid pain medication. I want you to take that if you need it. Don't take it if you don't need it. Start at the lowest dose. Some patients will feel mildly nauseated after the procedure is over. This is usually due to the anesthetic. If necessary, we have also prescribed the medication to help with the nausea. Place it under your tongue and let it dissolve. You can take that every 8 hours if necessary after the procedure is over. If you have essential medications that we need you to take in the first 7 days, I'm going to ask that you crush those up and take them with water or Crystal Light. These would be things like blood pressure medication or thyroid medication. Other medications that are not essential in the first week we'd like to skip. Examples would be anti-hypercholesterol medication. After the first week is over, we're going to change you to the soft diet. Soft is anything you can mash up with a fork that's low fat, low sugar, high protein. Examples include eggs, oatmeal, flaky fish, well-cooked vegetables, beans. It's probably best if you avoid carbonated beverages for at least 1 month. By themselves, they will not cause a complication, but you may be uncomfortable with increased belching. 4 weeks after the procedure, you will switch yourself over to the solid diet. This just means you don't have to be able to mash it up with a fork. It still needs to be healthy, low fat, low sugar, high protein. We'd like to see you back in follow-up at 3 months after the procedure. At that time, we'll check your blood test to make sure that your vitamin and mineral levels are okay, as well as your protein levels. We'd also like to see how you're doing with your weight loss. In addition, we'll reinforce good food choices and consistent exercise. We'll do that again at 6 months, a year, and every year after that. Post-procedure follow-up is essential to a good outcome after any weight loss procedure.